I'm going to be talking today about a document that was developed to look at health considerations for urban development and how we've used that document within the district to try and make some change in the way urban development is addressed and how we put forward health aspects of urban development in planning processes. And I'd like to acknowledge several people that were involved with this. Cleet Simpson, who was actually going to present today but was unable to make it, and a team of people from population health and planning, some of whom are hopefully here today, who have helped with this document. I'd also like to thank Isabel Hess for helping me with these slides. She's over there. So what I will cover in this very short talk is the background to the development of this document, Building Better Health, which is essentially a guide for health planners, and the objectives and overview of the guide, some examples of application of the guide in Sydney Local Health District, and I'll talk about how we've distributed the guides and what the implications of this guide are for how we deal with health issues in the planning space. And Walter, I believe, has some copies of the guide, which we might just sort of pass around so people can see what I'm talking about. So just the background, as has been alluded to earlier, there's a lot of urban development occurring in Sydney Local Health District at the moment at a very rapid pace, and I'm sure not one of you here has not been affected in some way or seen the urban development that has occurred. We've obviously got the WestConnex stages 1, 2 and 3 occurring in our district. There's about to be the redevelopment of the Bays precinct. The Green Square development is well and truly underway, and we've seen that beautiful building in Central Park. So there's a lot of urban development occurring and much more to come. Whole suburbs have actually developed before our very eyes. This is the Harold Park suburb. It's actually now a new suburb and will have a large amount of housing in it. So we have from time to time provided advice and health advice on different parts of development, but it has been patchy, and increasingly over the last couple of years, health has been asked to provide input into planning processes, and this is a really good thing. But what we found was that different parts of the district were being asked to participate in various meetings or comment on particular documents. And what we really needed was some consistent messages and a common agenda, and also an evidence base for the feedback that we were giving. And there were some previous state guidelines around the New South Wales Healthy Urban Development Checklist, but those guidelines were, I guess, a bit out of date, and they really weren't locally focused. And so there was a lot of this going on. There was a lot of talk, but what it was actually achieving in terms of health outcomes and in terms of outcomes for our population and for our community seemed to be a little unclear. So we also know, as has been mentioned today quite a few times, Sydney Local Health District has a culturally and linguistically diverse population. We really specifically need to consider the needs of our Aboriginal and Torres Strait Islander population. There are differentials in health status, as alluded to in the equity talk, especially in relation to chronic diseases across the district. And Sydney, this part of Sydney has, as we see from this building, a really industrial past. Lots of contaminated sites, and so every time we build or we dig up contaminated sites, there are things that need to happen from a health perspective. And as has been mentioned earlier, there's marked socioeconomic differentials in this district. So we have 10% of the population, 10% of the suburbs in Sydney LHD are in the most disadvantaged suburbs in the country, and 10% of the suburbs are the most advantaged suburbs in the country. So major differentials. We also know that the built environment has significant influences on health. A direct influence on the incidence and prevalence of chronic disease, overweight and obesity, type 2 diabetes, heart disease, respiratory disease. Most people know that. But we also have, the built environment has an indirect influence. If we don't have a sustainable environment, we will we are seeing the impacts of climate change, and with climate change comes other issues such as floods, heat waves, mosquito-borne disease, etc. So we need to address all of that in our development considerations, and there's an important imperative to protect us from health risks. So the objective of this project was to develop a template or a guide to use that we could all use in the district, and any staff could use who might be talking about urban development. And the emphasis on this guide was on the link between the health and the environment. It was supposed to be short and easy, very relevant for local use, including our local contacts. It would specifically mention the contact details of specific experts within the district, and it would cover a range of health issues. And our target audience at that stage was, when we started to develop it, was Sydney LHD staff who go to meetings and who have these discussions, and other stakeholders such as planners, councils and developers. So here's just a copy of the document, and we are circulating it, a very short guide, evidence-based. It's available online, a range of issues to consider, and I'll allude to those a little bit in the next slides, but it doesn't cover developing hospitals. It's not about developing Canterbury or Concord. And the types of issues that are covered include things like health promotion. There are so many things that impact upon health, and I've listed them there. Everybody sort of knows that these things, they're common sense, you read about them in the papers, but in fact there's no document that sort of brings it together in a simple way for planners to go, tick, I've covered this, tick, I've covered this, and this is what we tried to do in this document. If we look at the Green Square development, which I mentioned, it's got a lot of features that are indicative of healthy urban development, pedestrian cycle friendly, increased lighting for the streets because safety is an issue, public transport, social infrastructure. These are the sort of things that are covered in this Building Better Health document. Similarly, there's a lot of issues about protecting the public from health risks, and we've listed all of those, and we've provided links in our document to resources where planners or whoever it is that's looking at the document could then say, right, we've ticked this off, we've covered noise, we've covered air quality, we've covered pests, or whatever it is. An example of sort of the health risks sort of aspect of it, everyone's seen this beautiful building, Central Park. It has a recycled water network in that, and we've provided input in the public health unit into that recycling project to ensure that that this recycled water system can work well and be sustainable and provide really significant benefits from a sustainability point of view, while also protecting the health of the public. Health equity, we've heard from our Health Equity Research and Development Unit, but this document also includes equity considerations, including suggesting ensuring community representation, undertaking a health impact assessment and providing affordable housing. All of these things are really important for health, yet they've never really been considered within a health framework within our district, and something that we can we've never had anything tangible to give to people, and particularly to planners. We also included some information on housing for health, which is I won't go into, but it's a section on disadvantaged communities. So the guide has been approved by the board. It's been distributed to all councils within the LHD, government departments, big developers, and it's being used by staff in its interaction with other agencies. It's had quite a lot, it's only been developed a year ago, but it's got quite a lot of impact to date. It's been well received, great feedback from the Mayor of Sydney Council, the CEO of City Council. It's been adapted for use by 2 local health districts already, and it's being used in planning requirements already. Last week I heard that Waterloo, there's a big statewide development in Waterloo, and they've specifically said that the parameters of Building Better Health need to be used in that planning. Our district staff are now referring to the guide, and the intent is really to have no more meetings without content and structure, but to have a much more evidence-based approach. So in summary, we have an evidence-based template for local discussions about urban development and health. The expectation is that it will be written into health impact processes, like I've just mentioned in Waterloo, and our plan is to update it. We always want to make it better, and so we will be updating it again at the end of the year, and some other areas that we want to include in it include injury prevention and promoting healthy ageing. So that's it. Thank you very much.